Hello and welcome. Today we're going to talk about a medication for type 2 diabetes called Glipizide. We're going to break down what it is, how it works for you, and all the must-knows for taking it safely, all in just about 5 minutes.
So, if your doctor just handed you a prescription for Glipizide, you are in exactly the right place. This quick explainer is made just for you, to give you the key info you need nice and clear. Let's dive right in.
All right, first things first. Let's build a solid foundation. We'll start with the absolute basics. What exactly is Glipizide?
In a nutshell, Glipizide is a pill you take by mouth. It belongs to a class of drugs called sulfonylureas, and really, its main job is to help your body get a much better handle on blood sugar levels when you have type 2 diabetes.
Now, this is a super important point. Glipizide works by helping a pancreas that can still produce some insulin on its own. That's why it's only for type 2 diabetes. It's absolutely not for type 1, where the pancreas doesn't make insulin anymore. Bottom line, the medicine needs a pancreas that's still in the game to do its work.
And it's really crucial to remember that this medication isn't some kind of magic bullet. Think of it as one key player on a bigger team. It's designed to work together with a healthy diet and regular exercise to really get your blood sugar under control.
Okay, so let's pop the hood and take a look inside the engine room. How does Glipizide actually get the job done in your body? This really sums it up perfectly. The easiest way to think about it is that Glipizide gives your pancreas a little push or a nudge, encouraging it to release more of its own insulin, especially right after you eat, which is exactly when your body needs that help the most. So how does that push actually happen? Well, it's like a cool little 4-step chain reaction. First, the medicine latches onto special cells in your pancreas. Second, this causes a tiny gate on the cell to close. Third, that closed gate triggers another gate to swing open, letting calcium rush inside the cell. And fourth, that big rush of calcium is the final signal that tells the cell, all right, let's go, release the insulin. So now we know what it is and how it works. Let's get practical. Think of this next part as your personal user manual for taking Glipizide the right way.
Glipizide usually comes in 2 main flavors. There's the immediate release kind, which you might take once or even twice a day. And then there's the extended release, or XL version. That one's designed to be taken just once a day, usually with your first meal. It's so important that you know which one you have.
And here's a number you really want to burn into your memory: 30. For that immediate release version, timing is everything. You take it about 30 minutes before you eat. Why? Because that lets the medicine get to work and peak right as the sugar from your food hits your bloodstream. It's just perfect timing for the best results. Okay, I need you to pay really close attention here, especially if you have the XL version. That tablet is a tiny piece of technology. It's built to release the medicine slowly all day long. If you crush it or chew it, you completely wreck that system and get the whole day's dose at once, which can be dangerous. So please, always swallow it whole. All right, let's switch gears to a really important topic. Look, every medication has potential side effects, so let's run through a quick but crucial safety briefing for Glipizide. The number one thing you need to be on the lookout for is something called hypoglycemia. That's just the medical term for low blood sugar, and it's the most common and, frankly, the most serious side effect you need to know about.
So how would you even know if your blood sugar is getting too low? Well, your body sends out warning signals. You might feel shaky or start sweating. Maybe your heart starts beating really fast. Or you could feel dizzy, suddenly starving, or even a bit confused. Recognizing these signs is absolutely key.
Now, besides low blood sugar, there are a few other things some people might experience. This could be anything from feeling a little dizzy or drowsy to some nausea or heartburn, and once in a while people might notice a skin reaction like a rash. To play it safe, it's also super important to know that Glipizide can interact with other common things, from alcohol to other medications. Let's take a look. So some things can actually boost Glipizide's power, which sounds good, but it really just increases your risk of your blood sugar dropping too low. We're talking about things like alcohol, certain blood pressure meds like beta blockers, and even taking high doses of aspirin. And then you have the flip side. Other drugs can actually work against Glipizide, making it less effective and letting your blood sugar creep up. This list includes things like corticosteroids, certain water pills, and estrogens. This is exactly why your doctor needs to know every single thing you're taking.
Whew, we've covered a lot of ground. So let's wrap it all up with a simple, easy-to-remember safety checklist. These are the absolute must-know takeaways.
Rule number 1, and it's the most important, take it exactly as your doctor prescribed. And if you have that immediate release version, please don't forget that 30-minute rule. Seriously, set a timer on your phone if it helps. It makes a huge difference.
This one is a non-negotiable, golden rule. You just took a medicine designed to handle the sugar from the food you're about to eat. If you skip that meal, your blood sugar has nowhere to go but down, and that's a direct path to hypoglycemia.
And finally, make yourself an expert on you. Learn the signs of low blood sugar and tell your family and friends too. Make sure the people around you know what to look for and what to do, like having some juice or glucose tabs handy just in case.
And there you have it, the essentials of Glipizide in a nutshell. Look, the goal here isn't for you to become your own doctor, but to feel empowered, to have a smarter, more informed conversation with your healthcare provider. So the real question is, how are you going to use this knowledge to be an active partner in your own health?